Too many of us are embarrassed, maybe just a little shy. We just don't want our veterinarian to know there are real issues at home. I'm talking about behavior issues with our pets. You might not even think to mention it to your veterinarian, but Dr. Pam Nichols of the American Animal Hospital Association wants you to know that your veterinarian really wants to hear about those behavior problems happening at your home because, well, it may save your pet's life.
Your veterinarian cares because we really want you to have your dog or your cat for 15 to 20 years. That's our goal. So yes, behavior matters a lot. I do think people get embarrassed. So the most prevalent time for that is about their 1-year checkup. So your puppy came in as a 4-month-old and the entire staff gooed and gawed over the baby and it was darling and it got its last set of vaccinations, it got dewormed, hopefully it started on heartworm, and they said, see you in 6 months to a year. At the 6 months to a year point, the owner walks in with this puppy and maybe it's a breed that's predisposed to be a little nippy. So herding breeds, corgis, heelery things, cattle dogs, lovely little dogs, but if they're not guided the right way, they become biting little brats.
Yep.
Parents are embarrassed and they think they've done something to encourage it. And frequently they have, if veterinarians haven't done a really good job at their puppy visits of discussing appropriate behavior and what's right, what's wrong, what's good, what's bad, what's tolerable, what's not tolerable. And your veterinarian may say something to the effect of, imagine your pet at 2 years old and full-grown weight and tell me if you think this behavior will be cute at that time. And that's the limit of what's said at that first puppy visit, and not how to stop it, how to prevent it, how to identify that it's getting really, really bad.
And because of that, it's important to notice any changes in your pet's behavior. Listen, if your pet is acting differently, there's a reason for it. Sometimes that reason may indeed be medical. That's especially true with older animals. So anytime there's a change in your pet's behavior, please contact your veterinarian.
That's absolutely correct. So we think about cats, that's especially prevalent. So there are a plethora of medical conditions that can cause pain. So for example, getting in and out of a litter box, a kitty that's obese or that's painful with arthritis, and that's a huge number of our cats are obese and have arthritis. They might start urinating out of the litter box because they don't want to climb in. Kitties that have started scratching, frequently it's they've got mouth pain. They don't want to bite, so they scratch. Kitties are frustrated if they can't do something that they want to do, and so it comes out in other ways. Same thing with dogs. Their behaviors can be behavior can be completely pain related, can be related to a medical condition, and so we need to know, for example, urination problems, which is the one people get the most embarrassed about when they say, yeah, my dog pees in the house every single morning and I still have to clean it up every single morning. Well, does your dog have a urinary tract infection? Well, she's been doing this since she was 4 months old. Okay, she may have had a urinary tract infection since she was 4 months old. I've seen puppies or kittens as young as 10 weeks that had bladder stones that will cause painful and inappropriate urination. People just think they're inept at doing potty training.
Your veterinarian is working to build a better relationship with you and your pet. That's really what it's all about. It's about prevention as well. So if your veterinarian gets a heads up before that behavior spirals out of control, truly, the result may save your pet's life. You can learn more at AAHA.org. I'm Steve Dale.